Hello and welcome to our special coverage of the 2026 ASCO Annual Meeting on the ASCO Daily News Podcast. I'm your host, Dr. Monty Pal. I'm a medical oncologist, professor, and vice chair of academic affairs at City of Hope in Los Angeles. Now, I'll be bringing to you brief analyses from selected abstracts from each day of the annual meeting. My disclosures are available in the transcript of this episode. Today, I'll be reviewing 3 abstracts, including a follow-up for the EV302 study. I think we're all aware of that one, in urothelial carcinoma. Potential new treatment option for patients with PD-L1 positive advanced non-small cell lung cancer, and a novel psychosocial digital application that improves fatigue and distress in patients with multiple myeloma. Why don't we begin with abstract 4507? Now, this is an update of the EV302 study. Now, just as a refresher, enfortumab vedotin is actually an antibody-drug conjugate that's really revolutionized care across multiple settings in urothelial carcinoma. Having said that, the EV302 data is actually the first setting in which we saw significant activity in a phase 3 trial with use of this agent in combination with pembrolizumab. The investigators here, led by Tom Powles, updated 3.5 years of median follow-up and had some really interesting subgroup analyses as well. Just as a refresher, in this trial, patients were randomized in a 1-to-1 fashion if they had metastatic, previously untreated urothelial carcinoma to enfortumab vedotin in combination with pembrolizumab, or what's really been heralded as a standard for several decades, which is platinum-based chemotherapy, either cisplatin or carboplatin with gemcitabine. Now, with 42.8 months of median follow-up, what we saw here was a survival advantage that seemed to consistently favor enfortumab with pembrolizumab. If we look at the landmarks at 42 months, the survival rate was 83%. Now, this is just remarkable when we consider what outcomes associated with the disease used to look like. The median time to complete response was actually about 4.5 months in the context of this trial. And the data also adds several elements related to conversions from pathologic partial responses to complete responses. And I do think that this adds really an air of further intrigue to the data that we've already seen around the combination of enfortumab with pembrolizumab in this setting. 2/3 of patients achieving a complete response converted from an initial partial response, suggesting that perhaps after initial response, cure is still achievable. I'm going to shift gears now and discuss our second abstract. Now, this explores an agent known as sacituzumab tirumotecan. This is abstract 8506, and it looks at this agent, which I'm going to refer to as SAC-TMT, with pembrolizumab versus pembrolizumab alone as first-line therapy for PD-L1 positive advanced non-small cell lung cancer. This was known as the OptiTROP Lung-05 study. This was conducted by investigators based principally in China, led by Keikun Zhao. And in this particular clinical trial, patients were randomized in a 1-to-1 fashion in this study to receive either SAC-TMT with pembrolizumab versus pembrolizumab alone. Now, importantly, the patients who were eligible for this study had treatment-naive, locally advanced or metastatic non-small cell lung cancer. They did not have EGFR or ALK alterations, and they did have positive PD-L1 expression. So the primary endpoint in this study was progression-free survival. This was assessed by blinded independent central review, and a key secondary endpoint was overall survival. What they saw in this study is that with a median follow-up of 10.5 months, progression-free survival by independent review was significantly longer in the SAC-TMT group. The estimate was not reached as yet in that subset versus 5.7 months with pembrolizumab alone. This amounted to a hazard ratio of 0.35 with a significant p-value. There did seem to be a favorable trend in terms of overall survival, although the authors note that it wasn't quite the right time. The overall survival data was not mature. Having said that, the hazard ratio was 0.55 in this context. If we look at pre-specified histologic subgroups, and we're always interested in that distinction between non-squamous and squamous histology, we saw here a hazard ratio for benefit with respect to PFS of 0.28 in those patients that were non-squamous, and those patients that were squamous had a hazard ratio of benefit of 0.44. Now, importantly, if we think to the toxicities that we incur with this regimen, there were significant neutrophil count decreases, anemia, and stomatitis, and we might potentially anticipate that with drugs of this nature. To the investigators' knowledge, they purport that this is really the first time that we've seen a significant progression-free survival advantage with the combination of antibody-drug conjugate with pembrolizumab versus pembrolizumab alone. It's exciting to see how this regimen will develop, and I know all eyes are going to be on the final survival analyses from these data. I'm going to close out our discussion with a discussion around the THRIVE-MM study for patients with multiple myeloma. This is abstract 1513. This was presented by Dr. El-Jawari from Massachusetts General Hospital, and it really involves, I think, a very unique effort. As we all know, treatments for multiple myeloma have gotten so much better over the years, and we've moved from doublet therapies to triplets to quadruplets, and there's even some discussion in clinical trials of quintuplet therapy for this disease. But having said that, there's certainly a number of toxicities that patients incur and a significant need to help in managing those toxicities with various interventions. So this Thrive MM or multiple myeloma study looked at a self-guided psychosocial digital application, really with the intent of improving quality of life, fatigue, and psychological distress. This was a single center study, so keep that in mind, which used the Thrive MM model versus usual care. Patients had to have newly diagnosed multiple myeloma. They also could have potentially had relapse disease receiving second or third line therapy, and also they could have been on maintenance. They were stratified by this line of therapy, and they were randomized 1-to-1, as noted earlier, to receive either usual care or Thrive MM. And ultimately, what was found in the context of the study, with really a very healthy number of patients enrolled, 120 out of 203 eligible patients, what they found was that there seemed to be some degree of improvement in fatigue. They seemed to have a decrease in depressive symptoms. They, however, did not see that there was a significant improvement in quality of life, and that's quite notable. Having said that, with hopefully what might amount to a low-cost intervention, it may still be of worth to further explore whether or not something like Thrive MM could be incorporated in clinical practice. Fatigue and depressive symptoms are certainly things that we want to focus on in terms of the day-to-day lives of our patients. Well, there you have it. Thank you so much for tuning into the ASCO Daily News podcast. You can access the abstracts mentioned today in the transcript and join me again tomorrow to hear more top takeaways from ASCO26. An awesome meeting. And if you enjoyed this episode, be sure to hit follow on your favorite podcast app and leave a review.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.